Is the mandatory COVID-19 isolation period ended in Victoria? Yes, Victoria's pandemic declaration ends on October the 13th, 2022. You are no longer required to isolate for 5 days if you test positive for COVID-19. Are there exceptions? Yes, there is an exception for those who work in high-risk settings such as health and aged care. Those employees will still need to isolate. Does this mean people can go to work and school while positive for COVID-19? It means people will no longer be mandated by law to stay at home for 5 days if they test positive for the virus. It means people could attend work and school unless they are in a high-risk setting such as health and aged care. However, just like having flu, it is still strongly recommended for workers not to attend work if they are sick. What about the pandemic leave disaster payment for people who test positive for COVID? That is also ending. However, there will still be some financial support for casual workers in aged care, disability care, indigenous health care, and hospital care sectors. Does this mean COVID-19 is becoming less infectious? No, COVID-19 is no less infectious. COVID-19 is still dangerous and very infectious, but because of the low rates of the cases at the moment and the high level of vaccination, the isolation period is no longer mandated. Could mandatory COVID-19 isolation periods return? Yes, the mandatory isolation periods might return in the future if the number of COVID cases in hospitals increases. What is changing in our region, Geelong? First, testing sites. For a full list of testing sites in the region, go to www.bswphu.org.au/where to get tested, or scan the QR code showing on the screen. 2. Support for people with COVID. From October the 10th, people who test positive for COVID will no longer receive a call or SMS for support and assistance. Only those who are vulnerable to COVID-19 will receive this call or SMS. For example, people aged 80 years and over, people with health issues, or a person living with a disability. It is important to remember that the public health team is still there to support the community and can be contacted if unwell or needing medical assistance. If you or someone you love begins to experience shortness of breath or dizziness or are concerned about your well-being, please contact your GP. If you are unable to contact your GP, contact the respiratory clinic at 0399 75 8401 or Bowen Health's COVID-19 hotline at 1300 942 241. If it is an emergency, call 000. Remember, although masks are not required in public transport and most indoor places, they are recommended. It is strongly recommended to isolate if you test positive for COVID. Masks are still required in clinics and hospitals. Stay up to date with your vaccination and get your 3rd or 4th dose of COVID vaccine. COVID is still there, still very dangerous, and the number of COVID cases might increase again in the coming months.